You know, we were talking numbers earlier, Tommy, and 1 in 5 American men struggle with alcohol dependence, 12% struggle with drug addiction. But how about this number? 1 in 4 American men will die of heart disease this year. That's a terrifying number.
That's some scary stuff. You know, it reminds me of a client I actually had in here last year who was just lucky enough to be able to tell his story.
December 4th, 2019, I died. When I pulled up to the stoplight in Barnes Center, I put it into park. I had the window down. The lady 2 cars behind, she came up to me and she checked my pulse, and I didn't have a pulse. The fire captain, which was less than a block away, was leaving at that time, pulled up behind all of the commotion going on. They pulled me out, put me on the grass. She did chest compressions, and then he got the defibrillator. They shocked me, and then within 6 minutes, they had to shock me again. They had to put me in medical coma, a medically induced coma. So
incredible.
Yeah.
Do you think there's anything you could have done to prevent that day from happening?
Wow. I don't know if all guys are like it, but I know that a lot of guys, they just like, we don't need doctors, we don't want to go to the doctor, they're anti-doctor. So to be honest, if I was going to a doctor, normal care, having normal checkups, that's possible that I might have been able to avoid it. Mm-hmm. What I have is, it's called cardiomyopathy, and it's a weakening of the heart or heart muscles, and basically my heart, instead of being a muscle that's, you know, contracting, fully contracting, mine was contracting about 15%. I mean, I'm a miracle. So there's nothing short of the fact that I'm a miracle, because I fully recovered. And again, I think there's 3% of the people that survive what I went through. I mean, men's heart health is I mean, I guess I was educated because it's a thing, it's a real thing.
You know, one of the things I took from John and I's conversation was this underlying theme we seem to have, the stereotype of I'm okay, and I don't need to go to the doctor.
That's ironic, isn't it? Because, like, you know, as men, we're the fixers. Right. You know, your car breaks down, you fix it. Your body breaks down, you should fix it. That reminds me of the guy you were telling me about, whose unmanaged diabetes just about killed him.
Well, I was 49 and a month away from my 50th birthday. My life changed. So I was playing ball down at the YMCA, and I hit the game-winning jumper. I went to the side, and I went down. And it took 13 minutes for them to revive me and take me to the hospital.
You went down like out?
Like out.
No kidding.
7 days later, I woke up in the hospital. So I was in a coma for 7 days.
7 full days?
I don't remember anything. I just knew one thing, that my wife was by my side the whole time. By the grace of God, I survived. And after they woke me up, I had to have a quadruple bypass.
Oh, wow, that's incredible.
And all along, I realized I was diabetic. We were trying to get control of my diabetes at the time of the heart attack, and didn't really know how bad it was. My cardiologist told me, hey, I think you probably had diabetes for a lot longer than you knew. And I didn't really have any true symptoms that I was aware of at the time.
So how dangerous is it for you to not manage your diabetes?
Well, if you don't have control of it, it can kill you. I mean, because high blood sugars are not good for you, but if I had a choice between the two, I'd rather have a high than a low, because a low, you can actually go into a diabetic coma. You know, when you're young, you think you're invincible, you know, and we need to know when we're younger if the things that affect us when we get older. Sometimes it runs in the African American family, but we don't always realize the importance of knowing our history, because the history that we have, it affects you.
So why do you think that is? Why is it that people in your culture and people of color and African Americans don't really take care of the signs ahead of time or look into them?
I think a lot of it is the past, and people fear sometimes going to the doctor. If you don't deal with it, then you should fear it, because there are, amputations. You can lose a foot, you can lose a leg. I'm going to speak to some African Americans who have a tendency to be afraid of these things. There's no need to be afraid. That's what the doctors are for. And you have the faith in God to get you to the right doctors.
There's some research out there that says men are afraid to go to the doctor because we're afraid to hear bad news. But these stories, the bad news comes. And wouldn't you want to be prepared? With diabetes, that can lead to a whole long list of other problems. Heart disease, stroke, vision loss too.
I was dead for years and years and years emotionally. The only thing I could feel was rage, really, or anger.
Coming up next, anger and abuse. Why the numbers show men and women get mad at equal rates, but men are more likely to have anger issues.